there is this provision that the access to healthcare is a very important part of the obligatory functions of governance. That's one part. But again, in terms of, if you look at the 2013 right to food security, and if it talks about rights of women, especially rights of women in terms of giving birth, in terms of, it said there should be a certain amount of 6,000 rupees per child given. Okay, that's something that's important. And if you look at Directive Principle State Policy, Article 39E talks about the rights of, the right to health of workers. Okay. There is, the part where workers have their own special healthcare systems. But again, that's only people in the organized sector. If you look at one particular area, especially in rural areas or across the world, last year, or last 2-3 years, over about 343 million people were affected by pesticide poisoning. And in India, in the last 2-3 years, about 7,000 deaths have taken because of accidental pesticide consumption. So when you talk about the first figure of 343 million, it's about 44% of people engaged in agriculture. Okay. So when you say the rights of workers, what about the rights of agriculture workers when exposed to pesticides? Many of the pesticides are very, very toxic. And many countries have banned the use of these pesticides. And if you look at Maharashtra especially, the district which has the highest number of pesticide poisoning is a place called Yavatmal. Yavatmal is in Vidarbha. Okay. So what about that as an issue? Or if you look at in terms of the sexual and reproductive rights of women. So if you look at they found in one study found in states like UP, Bihar, okay, about 60% of women are anemic at the time of childbirth, and therefore it can affect the health of women and the child to be born. And therefore all of them must have access to iron tablets and folic acid. But in many of these states, at least especially in 2020, about 76% of women did not have access to this. So if you're talking about the right of a mother to be able to give birth to a healthy child, what kind of support systems are necessary? Now, this is something which is, again, which I don't know whether we are even considered that when you say about the right to health. The other thing we talk about the right to health is it's connected to nutrition. India has the largest number of people who are malnutrition in terms of sheer numbers. The numbers are more than in sub-Saharan Africa. If you look at the number of children who are born stunted, who grow stunted, underweight, a lot of these are important questions for us to ask in terms of, are we able to provide for basic right to health? And the other area is in terms of, there is a lot of deaths because of lack of clean drinking water. More than 250 million people in India do not have access to potable drinking water. Okay. Drinking water quality. So that's something which is in terms of contamination. Also, I don't know how many of you are familiar, in Mumbai city, there's a place called Mahul, which is near Chembur, where there are people who actually died because of the high levels of air pollution. So the Constitution does not really talk about the right to health, but some people see the right to health as a part of Article 21, the right to life. Okay. And the judiciary has given judgment which said that the right to clean living conditions is a part of the right to health. Clean water, clean living conditions. So, one objective of a program like the Swachh Bharat Mission was to ensure that you improve the quality of hygiene, and therefore you reduce the danger of infectious diseases. So we control zoonotic vectors, that is in terms of mosquitoes and flies, which can spread diseases. But if you're looking at some states, there are diseases like encephalitis, which a lot of us here have possibly not heard of. We don't even know what the symptoms are. So that's one in terms of when you say the right to health, what are the kinds of things which we think should be a part of the right to health? Okay. When you say right to health, how much importance is given to mental health as a part of the right to health? Okay. So that's one thing which I want. And the second thing which I want to talk about, when I talk about difficulty, I said the range of things which when you say right to health. The second issue is in terms of when you say rights exist in a particular ecosystem. What's the ecosystem? The socio-cultural context. Now, if you look at a constitution, about 5 or 6 years, 4 or 5 years after the constitution was promulgated, okay, Ambedkar, one of the architects of the constitution as chairperson, was actually unhappy with the constitution. Why? Because he felt in spite of the constitution, rights for large sections of the population was not available. So when you talk about the right to health, do you understand the ecosystem of the right to health? If you look at Mumbai city, about 50% plus lives in slums. Okay. Very poor sanitation, hygiene. And therefore, in that context, how do you really provide the right to health? I know how many of you are familiar with a place called Jadugada. It's in Jharkhand. Though the percentage of uranium is very less, it's the only operating uranium mine in India. And if you go to that area, because of radiation, okay, it has possibly one of the highest levels of miscarriage among women who are pregnant. Similarly, if you go to Kerala, northern Kerala especially, I don't know how many of you have heard of a chemical called endosulfan. Read upon the problems of endosulfan. So when you say the ecosystem of the right to health, so are we able to provide clean living conditions? Are we able to provide access to drinking water? Are we able to help provide access to different kinds? That's when I said the whole idea of mental health. Like if you look at Maharashtra, I think from 2011 or so, in Vidarbha region, NGOs and the government have come together and said that they must have a lot of support system for mental health. Because one of the major causes for farmer suicides, along with agriculture distress, is a kind of depression, etc., which is triggered off by extreme high levels of economic stress. One of the things which we have not monitored is what is the kind of mental health issues that people faced because of the lockdown and the COVID and all the other kind of economic challenges which people face and continue to face. So when you say mental health, it's such a broad area. And we can't talk about mental health as something which the state can do, because unless we are able to provide the ecosystem, it's impossible really to talk about the idea of mental health. When we say right to health, how can we guarantee the right to health? If you look at India, what is the budget of the government of India on health? It's 1.29%. Okay, in the last budget, they showed a lot of increase, but a lot of people go into water and sanitation, but actually health in terms of even health facilities. I don't know how many of you I've actually traveled in rural parts of India. In many parts, there are no primary health centers. Like if you go to Gadchiroli district, this is outside Gadchiroli city. 70% or 79% of primary health centers don't have adequate medical supplies, don't have medical health professionals. Or I remember, and I've taken students to Kashmir. My first visit to Kashmir with students was in 2009. And remember, in the middle of the night, one girl had severe urinary tract infection. And we rushed her to the public hospital. Okay? I think it's called Laldev Hospital. And went to the hospital. The hospital was overcrowded. We couldn't get a small vial to take urine sample. Okay. And remember that year we were able to have an appointment with the then Chief Minister. And the girl was affected. She asked him a question. She said, why are health facilities, public health facilities in Kashmir so bad? He said, the public health facilities in most parts of rural Kashmir has collapsed. So everybody comes to the capital, and therefore the pressure is too much. And I'm sure that's the case in many of the states of India. So how do you really ensure that in terms of that we are able to provide some kind of ecosystem for public health? A friend of mine who's working on public health, he's a PhD in economics, he's now working on his PhD in public health from Johns Hopkins. So he was asking me this question because as a political science teacher, he asked me, he said, why is public health never an issue in any elections? This is across the country. Okay? Public hospitals, the quality of public hospitals and the services they're able to offer are very poor. A lot of poor people also go for private hospitals. So why isn't there anger against the system, against the government for inability to provide for healthcare? And one of the things which in our conversation I said was that a lot of us don't think that the right to health is something which we think the government or the system should provide. And therefore we don't make them accountable if the right to health is not something which is respected or provided for. So when you say awareness, as individuals, as young people, students, most of you here are young students, in terms of what is your awareness, what will you do to raise the awareness that the government should increase spending or public spending should increase? And if you go to places like Sion Hospital, KM Hospital, JJ Hospital, Nair Hospital, that's the place where most poor people will go to. And look at, if you look at, it's affordable healthcare, but look at the kind of pressure which is there. In a private hospital, for a ward of, you'll have one nurse for about 10 or 15 patients. In KM Hospital, you may have one nurse for 100 people, or 150 people. So therefore, when I'm focusing first on healthcare, I'll talk about other things in some time. If you also look at Mumbai city, you can look at other cities also. When was the last time when the government has, invested in a new hospital? Look at all the existing public hospitals. About 2 years ago, I remember one colleague's father had a road accident near Chembur, and they took him to Rajewari Hospital. Outside it's a big building, but it didn't have an ICU. So they didn't have the kind of care, oxygen, and all those things which would possibly are necessary, when there's trauma. And that's the most important trauma hospital in that area. So which political party or which government has increased public health spending as a part of manifesto? How many of us ask our MLAs and MPs to really, take up public health as an issue? So that's in terms of healthcare. The second thing about public health is, who's going to pay for the right to health? Where will the money come from? Okay. Because at the moment, if you're looking at our tax structures and all of that, it is possibly just able to manage or not able to manage. Because investment in public health is a continuous program. A lot of poor people also go for private hospitals. So why isn't there anger against the system, against the government for inability to provide for healthcare? And one of the things which in our conversation I said was that a lot of us don't think that the right to health is something, okay, which we think the government or the system should provide. And therefore we don't make them accountable if the right to health is not something which is respected or provided for. So when you say awareness, as individuals, as young people, students, most of you here are young students, in terms of what will you do to raise the awareness that the government should increase spending or public spending should increase? And if you go to places like Sion Hospital, KM Hospital, JJ Hospital, Nair Hospital, that's the place where most poor people will go to. And look at, it's affordable healthcare, but look at the kind of pressure which is there. In a private hospital, for a ward of, you'll have one nurse for about 10 or 15 patients. In KM Hospital, you may have one nurse for 100 people, or 150 people. So therefore, when I'm focusing first on healthcare, I'll talk about other things in some time. If you also look at Mumbai city, you can look at other cities also. When was the last time when the government has, invested in a new hospital? Look at all the existing public hospitals. About 2 years ago, I remember one colleague's father had a road accident near Chembur, and they took him to Rajewari Hospital. Outside it's a big building, but it didn't have an ICU. So they didn't have the kind of care, oxygen, and all those things which would possibly are necessary, when there's trauma. And that's the most important trauma hospital in that area. So which political party or which government has increased public health spending as a part of manifesto? How many of us ask our MLAs and MPs to really, take a public health as an issue? So that's in terms of healthcare. The second thing about public health is, who's going to pay for the right to health? Where will the money come from? Because at the moment, if you're looking at our tax structures and all of that, it is possibly just able to manage or not able to manage. Because investment in public health is a continuous program. That's why they say is that often it's very difficult to really raise that kind of resources and on a sustained basis. Okay. I was talking about, to someone about this whole right to health issue. So he said when you focus on right to health, okay, it's good to be, it can become a part of the statute. But when you don't have the kind of policies and ecosystems to provide for that, it's in the context of health, he says it will be like Hathi Ki Dant. So you can have right to health enshrined in the constitution, and everybody will feel that it's a good thing. But on the ground level, how do you ensure efficient use of limited resources? How do you increase accountability? In a place like, if you go to Dadar, there is a Wadia's Children's Hospital. It has a fairly mid-size intensive neonatal care unit. I was talking to a doctor there, and the doctor said very often we have to turn away poor patients because we don't have that many ventilators. Sometimes they raise money through CSR. We also need high quality ventilator to do study, to do improve the chances. Therefore, when you talk about the right to health, I want to start looking at things which you've never really thought about. So when you say right to health for people with disabilities, for various kinds of disabilities, what is the kind of healthcare system we provide? Healthcare support we provide. Because sometimes there's not even awareness about these issues about mental health. I know an organization in Ladakh which provides a lot of daycare facilities for mental health. And one of the trustees said that in a lot of villages in Ladakh, if there is a child born with disabilities which are mental, sometimes they put the child in a cage. They don't treat the person as a full human being. To healthcare, how do we really look at these issues of healthcare? When we talk about ancient Greece, they had a practice called exposure. So if there was a person who was born with some kind of disability, the child will be left on the rocks outside the city for wild animals to eat, because they wanted people who were perfect. How much is society's attitude towards people with disabilities changed in the last 2,500 years? So when I say attitude, I see all of us will make the right kind of intellectual noises. What kind of support systems do we provide? So therefore, these are tough questions. We can have a very interesting intellectual discussion on the right to health. But at the end of it, what is the outcome? Okay. So my suggestion is PSA and the students independently. What is it that you will do to kind of create awareness about the responsibility of the government in terms of the right to health, and also understand the various dimensions of right to health. So if you go to a place like Nandurbar, at one time it had the largest number of children deaths because of malnutrition. Okay. So how do you make government programs for child health more effective? So therefore, this is something which you should look at. And the other thing is in terms of when I say ecosystem for healthcare. I don't know if any of you stay in Ulhasnagar, Dombivli, Kalyan. What are the rivers there? If you look at rivers like Kalu River, Ulhas River, it's so polluted. So is there a popular movement for the demand for the right to clean drinking water, potable drinking water for everyone? It's very interesting. In all the railway stations of Mumbai, you can do that. Go to a tap, take water, and think if it's a potable quality water. That's a public service. That's a public good which public institutions providing. You travel across India, and especially if you look at the kind of toilet and hygiene facilities, especially for women. So this whole idea of an ecosystem for health, clean living conditions, clean water. So how many of you had actually visited slums? How many of you have gone to Devnar, which is the largest dumping ground? It's supposed to be closed about 8 years ago. And a lot of children who go there, and they are they're rack pickers and others who are trying to get things of value which they can sell and make a living. If you look at Delhi schools have been shut. But the whole issue is that, is that a solution? Partly yes, but if the air is going to affect people in homes, and he's talking about the national capital, and we can keep blaming stubble burning, we can clean, but the fact that after all these years, there is no solution. So when I say ecosystem, there was a study which is done. They said that every second person in a city like Mumbai has lung-related ailments. So mild forms of bronchitis, tuberculosis. In other cities, worse. Every third person has some kind of elemental issue because of the kind of water we are drinking. So as a group, as a class, please start looking at some of these things. And also if you look at in terms of, some states, I was reading recently, about in terms of, the right of women. And I was very surprised that in terms of, Nagaland also is among the lowest three. Nagaland, UP and Bihar are the worst performers in providing support for, the health of women in terms of services. In a lot of cases in India, even now, women, because there's no hospital nearby, they live in places which are not accessible to the road. Women die on the way to a hospital because when pains start, and I've heard that near the Mumbai-Goa highway, there is a village called Koral. There have been cases because it's not accessible to the main road. There's a circuitous road. In monsoon, the road is cut off because there is the stream becomes a river. There are so many villages in Tamil Nadu, Himachal Pradesh, where there is no accessible road because of the terrain. I personally walked to a village which is at 4,500 feet from the plains. It's between the plains of Perikulam and Kodaikanal, which is at 7,000 plus feet. And it's a reasonable sized village. If anything happens, you either walk down to the plains or you walk up to Kodaikanal. And if somebody is ill, whatever else, how do you really carry a person? And something happens in the night, I mean, visibility is poor, and it's an emergency. So when you say ecosystem for health in terms of roads, transport, recently a former student of mine had come from the US. She's about 4 months pregnant, and she was saying that in Pune, because cabs are not available, and they had to take a rickshaw, and it was so. She said it was. I mean, she said I had to really squat because it was there was no suspension. The roads were so bad. So these are challenges and questions which I want all of you to really look at. And if you are people who have to bring about policy change, what will you change? How can you have better public-private partnerships? Some of them worked well, some of them have not worked so well. So the question is in terms of what are the solutions? Can you think of solutions, policy changes? How can you have public-private partnerships which make healthcare accessible to the poorest? So that is something which you must look at. And also look at success stories. Please Google this organization called SEARCH, SEARCH. SEARCH is an organization in Gadchiroli. And the two doctors, Abhay and Rani Bang, they've set up a really amazing hospital, which is actually, and their idea is to train a lot of medical care workers in all the tribal villages. So the tribals don't really have to walk 40 kilometers to come to a hospital. And if you ever get a chance, you must go there to see the hospital. Because that's what Dr. Abhay Bang told us. He said that when we decide to build a hospital, we first decide to ask the tribals what kind of hospital they wanted and what did they think was lacking in a hospital. All our hospitals have, all sheets and all are mostly white. For most tribals, white is the color of kafan. So some of them believe that if they go to a hospital, they come out dead. The other thing, even if you go to a hospital, I'm sure you're very intimidated. You don't know where the departments are. Where's the X-ray department? Where is the OPD? Where is the all of that? It's a myriad. So if you go to the hospital, it's built like it's like a courtyard. There's a central courtyard, and all the departments are around it. So you can see, you can access it easily. And the other thing in that hospital is they said that one of the problems with a lot of our health system is that if a person is ill, the person is alone in the hospital. Your visitors can come between 4 to 6. And one of the problems in ill is loneliness. So this hospital has built rooms where the families can stay and cook and spend time with the patient. They can stay there for 1 week. And they can cook their own food because there's provisions for that. So when you say healthcare, what are the kind of things which people need? Today, a major thing in a lot of policy, what is called design thinking. What is design thinking? Keeping the end user in mind when you're making a policy. What kind of facility, what kind of thing will the end user really find useful? Because a lot of us sitting here can have solutions which for end users may not make sense, may not be the best option. So as students, as young people, are you also listening enough to needs, to concerns, to solutions? Or people who may not have education on paper, but may have a lot of earthy sense of what works best. After the lecture, please Google this organization called Deccan Development Society. It's an organization in Telangana. Why it's interesting? Because the women there, many of them are non-literate women. They make documentary films and they train other people to make documentary films. They're also one of the first rural community radio stations. So therefore, there is a lot of these kind of things in terms of, so healthcare as a community thing, community solutions. And how do you really bridge the gap between different medical systems? Some people are very skeptical of so-called allopathic medicine. So how do you really bridge the gap with other systems, and how do you make sure that one is able to provide healthcare which is nourishing, which is helpful? So these are things about rights. As I said, once you enshrine rights, it's good to say we have the right. But how many people will have access to it? For how many people are rights meaningful in their daily lives? And right to health has been something which has been acknowledged in international human rights conventions from 1946. It's 75 years from WHO's declaration. So please give it thought and have conversations and have initiatives. Identify which area of health would you really want to look at. And also, if this week is about the rights of marginalized communities, what kind of healthcare do transgender people have access to? What kind of healthcare do other minorities have access to? I'm not talking about those of us who are privileged. I was reading an article in Economic and Political Weekly about people in Tripura. Because if you look at Tripura, today the indigenous population, the native population is about 25-30%. And they're most marginalized when it comes to healthcare and other kinds of care. And the article, and a lot of the people from Tripura work in cities like Bengaluru. So when there was lockdown, a lot of them are traveling back. And many of the fellow passengers will call them coronavirus because they have oriental features. So they either call them chinky or they call them coronavirus. So there's a lot of discrimination in terms of treating them as Indians. So in Maharashtra, I said, which are the communities which possibly lack access to a decent healthcare? Many years ago, I read, a fairly large-sized town like Malegaon got its public 200 first 200-bed hospital, public 200-bed hospital in 2010. So elsewhere, what is the kind of uh, facilities which are available to people? Yeah. So I'll stop here. I've thrown a lot of things for you to think about. So I'll take up questions because beyond this, I think is too much. Yeah. Any questions?
Okay, so one important note. Now we are going to start with the question and answer round. So please put your questions in the chat box and we will read them out for you. Or you can just type out C for comment or Q for question and unmute to ask whenever you are identified. So I would like to request Palak to ask the first question. If you guys have any questions, please put in the chat box.
Hello, sir. So my question is, when it comes to spreading the word about right to health, right? As you mentioned, that us as students need to take measures and need to educate ourselves on why we don't talk about it. So, what are your recommendations on as to how we can help spread the word about the same?
The first thing is to have see, do we as individuals believe that the right to health is important? And if you believe that the right to health is important, what according to us are the components of the right to health? So if you believe that the right to health is important, and one part of right to health is proper health care, so one can start a movement for better funding of existing government hospitals, or the request for creation of public hospitals. Because if you look at now a city like Mumbai or Greater Mumbai, it is spread beyond, in terms of Andheri and wherever. So what are the important public hospitals which are there in Vasai Virar, Mira Road, Bhayandar, Dahisar? So these are areas. Or if you look at the city of Pune, Pune is now, I think, one of the largest cities in terms of geographical area. So it has kind of enveloped a lot of the villages around. So can we start a movement for improving healthcare, expanding healthcare? Okay. Second, in the areas we are in, can we also kind of find a way to improve what I call the healthcare ecosystem? Okay. Do we treat our rivers better? Do we treat the air better? One simple thing, I find this horrific. A lot of people now, because all of us wear masks, but a lot of people will remove the mask and spit on the road. And the idea of mask is to prevent infection. So is there, in terms of, there's a need for change in habits? That's something, these are things which we will need to identify. And in areas, there are many areas, there are local communities. So can we make that as a part of a community project? The local area managing committees. So what are the kind of health issues they should be dealing with? So if there's a municipal office, if there is health department, do we know what their responsibilities are? And can we make them more accountable? And in the larger context, for us to be more sensitive to the fact today, when I'm talking about, sexual rights of women. In many parts of India, there are a lot of girls who are married below the legal age. And they also suffer from a lot of complications because of that. Okay. So there are a lot of things about this which we will need to identify and say that let us focus on, because we'll spread ourselves too thin if we take up too many things. So if the PSA wants to focus on one thing, choose one thing which you say you spread awareness or gather information, create some kind of movement towards better understanding. Okay. But as I said, the whole idea of healthcare itself is so vast. I don't know how many people are even aware that Article 39E talks about the right of workers to good health or healthcare. Or the issue of health is in the 7th schedule, with a lot of responsibility of the state governments, the federal setup. So do states need more funds? What are the issues? So there is so many things. So we will need to kind of identify 1 or 2 areas which you think you can handle. And some of you may be familiar with issues which I have not really talked about in a lecture, because every context will have different challenges, different problems, okay? Different solutions, therefore, because the challenges are different. Yeah.
Thank you, sir. So we have next question from Vaishali Khushi. What can we do to change the healthcare system of India?
See, it's too large a question. When you say healthcare, we need to first find out what's the kind of investment. Can we expect only government to make all the investment? Can there be better CSR? Can there be better private participation? See, how many of you are familiar with the Arvind Eye Care project? Please read about Arvind Eye Care. It's a project in Tamil Nadu and I think parts of Andhra Pradesh. But basically, the Arvind Eye Care it's a group of people. It's a private enterprise. It's not government. But they provide a lot of eye care solutions at the most affordable prices. Cataract, glaucoma, all these kind of things which are a problem with, which can cause blindness. The consultation fee, etc., is very low. And they provide high quality services to people who can't really afford high quality service. So read about that. So when you're talking about what is the solution, maybe that's why the solution will have to come from different areas. There is a book called Fortune at the Bottom of the Pyramid. Okay, it's a book written by C.K. Prahlad. It's a work on the work of another economist who says that if nearly 50% of the population is below poverty line, what kind of economic opportunities can be created? So if you look at all your, if you look at today you can get shampoo sachets for 1 rupee, 2 rupees. I don't know because I don't use shampoo, but a lot of these things are available at affordable rates. So the idea is that you can't afford a 200 rupees bottle of shampoo, but you can afford twice a week 1 rupee or 2 rupees. So some of these are, so what is the best way to provide affordable healthcare? So at the moment, what are the kind of successful projects in India? Some of you should read about what's called Jaipur Foot, providing prosthetics for people who have had problems with limbs, etc., and they're affordable. And it's a successful business model. So when they say solution at the national level, it's too big. And therefore, at the state and local level is what we need to look at. Of course, it will help if there is definitely greater budgets. And greater budgets will only happen when people believe that the right to health is an important concern which the government is responsible for also providing for. That the government must be held answerable. Like we do hold government answerable for price rise, for corruption, for various other things. So why can't we also begin to hold government responsible for provision of decent, healthcare? Because this COVID-19 exposed, not just in India, across the world, okay, the severe problems with public healthcare, where facilities were inadequate, solutions were inadequate. Yeah, I hope that answers your question. What is the next question?
So the next question is by Prashansa Shinde. There have been many international efforts for improving health, like Millennium Development Goals, etc. But why are those efforts lacking, as many of them have failed to achieve its objectives?
Okay. See, you talk about the Millennium Development Goals. They've been replaced by something called Sustainable Development Goals. the government of India is committed to meet these sustainable development goals. So, international effort can only provide assistance. International efforts can only provide goals and objectives. The implementation is something which has to be done at the level of the government. And for that, you need to have awareness of basic things. I don't know how many of you have gone to Banaras and you have taken boat rides on the Ganga. And I found that for me, the Ganga was very, very filthy. Because I could see this many years ago, sewage coming in, dead bodies floating, and whatever. So I asked the boatman, I said, so he said, he got very offended. He said, Ganga Maya can never be dirty. So sometimes we normalize lack of hygiene. It's become a lot, so it doesn't bother us. So therefore, if international efforts have to really have an impact, there's a lot of there's a need for a lot of change of mindset, habits, and I'm talking about community. I'm talking about cultural psyche. We respect public spaces, we keep them clean, ensure that rivers are kept clean, and everybody from individuals to corporates are held accountable for keeping them clean. So there's a massive collective effort. International efforts, yes, they'll provide assistance. They can give us aid, they can give us suggestions, they can give us, some solution. But solutions will have to be local because contexts are different. So setting goals is easy. That's why I said even tomorrow, if we make the right to health a fundamental right, how does it translate? Let us look at, in 2010, the right to education became a fundamental right. What has changed for the really poor people in terms of access to quality education? Because when we talk about right to education, we talk about education, nutrition, hygiene. There are lots of things that are connected. Why was it worthwhile for a child, for a family to send a child to school when the child can work at home and earn? So when they do a cost-benefit analysis, so an idea like the midday meal scheme, I remember when it was launched, a lot of people were very critical of the midday meal scheme. They said you are pouring money down the drain. But across India, midday meal scheme have been very good to not only to increase attendance, but also to increase the nutrition levels of children if it's implemented well. And it's important that you're giving them, there are a lot of controversies about the midday meal scheme. Some, of course, corporates want to give. So in some places, I think Parle and others wanted to be a part of it. They said they'll sponsor, but they wanted to give biscuits. They will sponsor biscuits, but biscuits have very low nutrition. So a lot of times they're looking at solutions. Are the solutions really the best? So policy changes, yes. The midday meal scheme has really been very good. A lot of people are very critical of National Rural Employment Guarantee Act. But in times of recession and times of lockdown, they at least provided some kind of employment and therefore earnings so people didn't starve. They could create effective demand. So it will be multiple things. So international efforts can only point directions, because finally the government of every country actually will reserve the right to decide what kind of policies will work for their country. Yeah.
Thank you so much for answering that. Next, we have Dr. Meenu Chandra, ma'am. She wants to say something. Ma'am, you can please unmute yourself. Ma'am, you can unmute yourself.
She's not there.
All right. All right then. Moving forward to the next question. The next question is asked by Jonathan. Srinivas. The question is that would privatization of public healthcare would be of any overall help?
See, that's why I talked initially about public-private partnerships. The only question is in terms of, is private participation in healthcare, can it be accessible to the very poor? The cost of health, good quality healthcare is high. And therefore, if somebody is putting in money, they'll want returns. Okay? And so most big hospitals will never recover the kind of money they're putting. For example, in terms of, if you compare, the near where I stay, there's a Reliance Hospital. Harkishan Das has been, it's a Reliance Hospital. So they have some, I don't know how many, 560,000 square feet of health area. They have 160 beds. So I was speaking to a doctor. The doctor said, no way can they ever recover. He said even something like Global Hospital, which is half the area but double the amount of beds, may at some point of time maybe be able to recover some of them. Recover costs. Healthcare is something which is cost intensive. So if the private players are willing to put in money and in terms of make it affordable, it's a great idea because we need solutions from all private, public, NGO sector. So when I talked about Abhay Bang, it's a NGO sector initiative which is doing very well. Similarly, if you look at private sector, there's a lot of hospitals like Arvind Eye Care. So there may be many such examples across India. So you could find out, private sector getting into healthcare, providing quality healthcare with a business model which is efficient is a fantastic idea. I think it's a very good idea. So that's why I said, please read up. Maybe you'll find more examples. Yeah. Any other questions?
Sir, there's a comment by Atharva.
I have one question.
Yeah.
In India, like for the middle class, most of the healthcare expenses are covered through insurance. Insurance covers a large part of expense for healthcare, but there has been many problems in health insurance because most of them come with a reimbursement, and many of the time the distribution between the agency and the person is not very adequate for that person to purchase. So is there any drastic change needed in this kind of uh, insurance for better health care, or what kind of solutions can we see in this field?
Okay. One is in terms of, again, when you say insurance, the idea of medical insurance, etc., and the government has also promised medical health insurance. In terms of who will bear the cost. Second, in terms of, yes, a lot of insurance are not really cash free, and therefore that makes it difficult. So reimbursement is a problem. Also, the way insurance normally charges, they calculate cost. So they will not really pay for a lot of things with their disposables. So therefore, you actually spend because it's a part of your expenditure, but they will decide what is permissible, what is not. So there's a need for constant, reworking of how to make insurance in that sense the best thing. Of course, see, even if you say insurance, you're paying for insurance. You're paying on a regular basis your Mediclaim, and only a portion of that is actually recovered through the problem of what should we say? When you go to a hospital. But that is an area which will possibly reform itself, and there will be need for push to reform. It is becoming better as people have been complaining, and there's more competition in the insurance sector. So maybe that will be, but there is need for a lot more accessibility, because the kind of premium which people have, a lot of poor people can't, and the kind of premium which government may offer for the very poor, they may not be able to pay for reasonable amount. For serious ailments. So if I have to have a bypass, if I have to have a transplant, the costs are massive. And a lot of the costs, if you look at the kind of medicines, they're very expensive. So what is covered and how do you do it on a on a regular basis. So if I am a person with a kidney ailment, dialysis. How do you make dialysis accessible, cheaper? So these questions, solutions still have to be found, according to me. Yeah.
Thank you, sir, for asking, for answering. Sorry. So if anyone has any other questions, they can type it in the chat box, and we will read in for them. So does anybody have any other question?
See, I'm sure there are no more questions, but see, there are certain things, how do you really sensitize yourself to issues of healthcare? Okay. Is an important question. In 2019 March, we had gone to this village called Mendaleka. Okay. And we met this person called Devaji Tofa, amazing gentleman. So he was asking students that all your education is book. What do you know of in terms of, ground level reality? Also, when you talk about healthcare, when 1 year, I think in 2013, we met a very interesting collector of Nagpur, and he served as collector in Gadchiroli. And he said the easiest thing for people to do in India is to set up a hospital or set up a school. And he said people think you're God. He said the real problem is in terms of creating, livelihoods. He says if the poor have adequate livelihood, they figure out what healthcare they want, what kind of healthcare services they want to access or buy. So that will be something is possible. So when you say, that's why I said the ecosystem is if the levels of poverty have increased because of recent pandemic or whatever, then healthcare will be affected negatively. So if your family's savings have been wiped out, so there is no money for medical emergencies. I had a friend of mine whose son had to go a bone marrow transplant because they could afford it. They went to the US. So one of my friends, other friends said that in India, a disease like cancer, only the rich can really manage well. Because private hospitals, the cost, and even this thing, the amount of money it kind of sucks in. But I'm also looking at basic things like tuberculosis. Tuberculosis has to deal with, poor in terms of quality of nutrition, quality of the environment. So many of us maybe actually, if we test it, we'll have tuberculosis. And also in the lockdown period, the tuberculosis cases in many parts of India spiked. Why did it spike? Because children couldn't go out, no exposure to the sun, especially if you're living in congested areas like Chawl and you go out, you can be fined. So exposure to the sun. So again, a lot of people in India, people living in congested areas have vitamin D deficiency. So it has to do with your right to clean living condition, right to habitat. So all of that are therefore interconnected. That's why I said the ecosystem is something which is very important. Yeah.
Just a kind reminder that the feedback form is posted in the chat box. I request every participant to go through the link and just fill the feedback form. And if there are any other questions, they can just ask in the chat box. Or they can unmute themselves as well if they have any other question.
See, this right to health is a part of what we call human security. It's a part of sustainable goals. So it's already there in somewhere in the idea sphere. The awareness for most of us is zero. That's my concern. Yeah, sorry. Somebody has a question or anything to say?
No, sir. So I see that there are no other questions here in the chat box left. So I would like to go ahead and thank you so much, sir, for answering all the questions asked by our participants and for this amazing session. Before we wrap this up, the event, we all know that
I think
by
somebody.
now that one of
Yeah,
the
I think
session for
one
event.
I
question
think
Yeah.
somebody has a question. Somebody
from
has a
Bhagyesh.
question.
Yeah.
Yeah.
Okay. Okay. Bhagyashree Solankar, please ask us. Please unmute and ask the question.
Can somebody read the question?
So she's asking, what is the
Yes.
value added of human rights in public health?
Could you please repeat? Yeah, sorry.
What is the value added of human rights in public health?
Now, see, the moment something is acknowledged as a right, the value addition is that you can claim it. You can demand that the system provides for you. Once you say something is a right, something is a... See, what is a human right? A human right is something which is necessary for basic human dignity. Okay? So, once you say that the right to health is right to nutrition, right to healthy living condition, right to health care, and we can make the government accountable for providing it, then there is that value add. So even if you look at now this whole idea of vaccination, okay, in most government centers it's free, and therefore the government is making vaccination accessible, okay, to people who can't afford to pay for vaccination. And in many places the government is also subsidizing vaccines, so that is affordable. So once you accept that this is a right of every individual, either to be vaccinated or now vaccination against COVID is important, but I'm sure all of us, when we are born, when we are children, all of us have gone through BCG vaccination. We've gone through a lot of basic vaccinations every child goes through. So a lot of these are provided as a part of the belief that every child must have access to basic, uh, safeguards for good health. And therefore, therefore, when you accept and say that this is a right, then it also pushes us to demand that the government invest more. Or the government is answerable for the quality of healthcare. Our government is answerable for ensuring that the rivers are clean. Or drinking water which we get is clean. Drinking water is very poor. I'm sure all our houses have aquaguard. This is our expense, but if in a poor household, if there's no money for an aquaguard, so the water they're drinking is not really of drinking water quality. So I had a colleague many years ago who said that the fact that all of us can buy a bottle of, they can buy bottled packaged water, means we're allowing the government to give up the responsibility of providing drinking quality water. I don't know now, when I used to travel by train long distance, we used to carry these big water bottles and we used to fill it at stations. A lot of people would do. And a lot of young people now buy, it's easy to buy, 1 liter, 2 liters, and you'll manage. So when you decide to spend money on this, then you're letting the government believe it's okay.